way to start off this new series of health shows than to have as our very first guest Steve Tullman, the CEO of the Phoenixville Hospital Tower Health. Over the past year and a half or so, since the Phoenixville Hospital has come under the ownership of the nonprofit Tower Health System, the hospital has gone through many changes regarding its facility, physician and nurse staffing, new clinical affiliations, and more. Steve is here to tell us all about these so that you, our viewers, can be more informed healthcare consumers and community citizens. So let's get started. Steve, welcome to the show.
Thanks, Lou. Okay. Happy to be here.
Good. So, first, tell us a little bit about yourself. How did you get here to Phoenixville? I know it's been a long time.
It's been a while. At the end of May, I'll be 15 years at Phoenixville Hospital as CEO. And as you remember, or some of our viewers know, I came back to the East Coast, where I'm originally from West Coast, California, Los Angeles. And it's been a great 15 years, and I think the future is going to be even brighter, quite frankly. Yeah.
Good, good. Well, obviously, we're very glad to have you here, and hope you have you here for another 15 years. So tell us about your role at the Phoenixville Hospital, and has it changed now that Tower Health is the new owner of the hospital?
Most of it has stayed the same, but then there's been things added to it. So it hasn't changed from the basic functions of the role of CEO, but things have been added to my plate. Now as you know, Tower Health is a regional nonprofit health system made up of 6 hospitals, Reading to our west, and then the 5 previous hospitals previously owned by community health systems. Because we're regional, we're much more collaborative as a system, and my role as a CEO of the hospital is to work collaboratively at the leadership level of the system to plan for the future and determine what services we should add, what services we should expand, and how we can better work together to collectively serve the population across our hospital locations.
That collaborative effort, does that mean that certain hospitals in the 6-hospital constellation will become specialists in certain areas?
I think the answer to that is yes. And another way of answering it is, excluding Reading for a moment, the 5 previous CHS hospitals, some of the things that we will do will always continue to do, emergency services, radiology, and so forth. But yes, to your question, some things that are specialized will be more concentrated at certain hospitals. So in the instance of Phoenixville, one of the areas that we've really become strong in over the years is in cardiology and cardiothoracic care, and we'll continue to really expand and enhance that and be a center of excellence. Another area will be women's health, where we've always had our NICU, and we've continued to develop those services. But there'll be other things as well, and we can talk as we go through the interview on that.
Well, tell us, Steve, a little bit about, I assume you have a senior administrative team.
Right.
Who makes up that senior administrative team?
As you know, I'm very fortunate to have had some very, very great partners on my team. The 2 that I've worked my 15 years with are Sue Reichenbach, our Chief Quality Officer, and currently Sandy Crabtree is our Chief Nursing Officer, but of course I had the tremendous good fortune of working with Sally Strelecki my first dozen years. And one thing I always like to tell people is in 40 plus years of Phoenixville Hospital, there's only been 3 Chief Nursing Officers.
Is that right?
Yeah, so and Sandy's got a long way to go, so that number will keep going up. And of course, Mike Kelly, who's been there before my time, is our Director of Operations. And then we also have a relatively new Chief Financial Officer. His name is Ed Chabalowski. Now, he's a veteran, worked at Temple University Hospital and with Geisinger, so we're really grateful to have his expertise.
Yeah.
And I don't want to be remiss. My assistant, the person who really runs things, is Sharon Carmelo.
She's tremendous. She's tremendous.
And if I didn't mention that, I'd be in trouble. So,
so tell us a little bit about Tower Health itself. I mean, how did that system get formed?
Right. So prior to Tower Health, which was October 1, 2017, was formed, the organization that formed it was referred to as Reading Health System to our west, which is essentially made up of a very large tertiary teaching hospital, Reading Hospital. And they had some other elements too, including a very large physician network, outpatient services, even a joint venture health plan. When that organization decided and was chosen and selected to purchase the other 5 hospitals, they decided that they needed to rename the system to give it a more regional, and that's how the name Tower came into being.
Do you know how they picked the
Yeah,
word tower?
I do. If anybody's been to the Reading Hospital campus, the oldest building on campus, which was built as a hospital building, has a very, very distinct clock tower.
Oh, okay.
And that's where it came from, yeah. Wasn't that far to look.
That's creative.
Yeah.
So what are the benefits, Steve, of the Phoenixville Hospital being part of a larger health system? I know when our foundation was first started
Right.
22 years ago, it was not real popular in the community
Right.
that the community hospital was going to lose its, quote, independence.
Right,
And so now that it's been part of some health systems,
right.
what is the advantage of that?
Well, I think with respect to Tower, the biggest advantage and that I see is Tower has a very long-term view of how things should get done, and really is a mission-driven organization, and its sole mission is to serve the healthcare needs and try to improve the health of the people who live in the areas that they serve. And it looks to do it over the long term. So that is a very, very positive benefit for our community, that we're now part of an organization that really is very singularly focused on one thing, and that is doing the best it can to improve health of people in our community and provide the very best health care. And there are very significant manifestations of that in the last 18 months as part of Tower Health. One in particular has to do with nursing. I don't have the number in my head, but we have been adding many, many new nursing positions to the hospital, not only to provide bedside care, but also to teach our nurses, to work with patients when they have questions, to educate them. And in fact, we're moving toward what's called magnet status for nursing, which some of our viewers may know of. Some of our local hospitals outside of Tower Health have moved to that level or accreditation. And Phoenixville, because of its legacy of strong nursing, is positioned now to move on what's called the magnet journey and achieve another distinction for nursing care. We expect and hope that we'll begin that in earnest later this summer, early fall, and then over 2 years move in that direction. Very
Okay.
positive for the community.
Sounds wonderful. We're going to take a break for commercial, Steve. We are talking with Steve Tullman, the CEO of the Phoenixville Hospital. And when we come back from a commercial from our sponsors, we'll have more from Steve about what's going on at the Phoenixville Hospital. Stay with us. Hello, everyone. For those of you who might be just tuning in, we have the pleasure today on For the Health of It to be talking with Steve Tullman, the CEO of the Phoenixville Hospital, and he's bringing us up to date on all the kind of new things that are going on at the hospital now that it is part of the Tower Health system. So Steve, let's venture into the community-based healthcare area. Phoenixville Hospital is, as I understand it, is one of the few hospitals around that has a community health education and outreach department.
Correct.
And it has had that for a long time.
Right.
So fill us in on what it does and what new little wrinkles you may have with it.
Sure. Well, as you know, as you mentioned, it's been in existence a long time, long before me. It was founded by Anna Mae Galbraith and Sally Strzelecki, both of whom still participate, but they're both now retired. So it's been taken over by Barbara O'Connor, who was Anna Mae's assistant protege. And we've actually expanded it. We've added more staff, and it will play a more significant role going forward than it already has in the past. Okay. Essentially what it does is, as its name suggests, it's focused on trying to improve the health of people who live in the community who are often underserved, either because they may not have actually transportation access to get care, they may be underinsured or uninsured, they may not be able to get out and come to the hospital or to the doctor's office. So we have a team of nurses primarily who work to go out in the community, provide health screenings, provide home visits, provide education, provide support groups, and they also tend to focus on certain areas that are really more pressing. A big focus has always been tobacco cessation and an anti-smoking campaign, especially at the younger ages in the schools. Very big focus on that, and we are fortunate to be the recipient year in and year out of tobacco grant funds to be able to help address those issues. Going forward, and I'm glad you asked that question, because we're now a nonprofit hospital, or we're returning to our nonprofit roots, I should say, that means we're required as a charitable organization to actually address unmet community needs. And it starts with a community health needs assessment, which I know you are aware of because the foundation has done one. And then we are about to complete it. And we've identified community priorities, unmet needs, or most pressing social determinants of health and direct healthcare needs. And our board will approve those priorities probably in March or April. Then we'll develop an implementation plan with community leaders in these areas for review and approval by our board in the fall, and then implementation over a 3-year period. And that plan will become public. It may be something that we want to talk about on a future show as well. Yeah. And I think you and I have spoken, and I know we've talked about some of the things we've identified consistent with what the foundation has identified in terms of mental health issues, smoking, addiction, transportation, etc. So we're excited about that, and our area will grow in this because of this. So you'll see more.
Yeah, from our perspective at the foundation, it's really even more exciting now, because now that you're back to being a nonprofit hospital, it opens up more opportunities for collaboration and funding between us.
Right.
So it's great. Well, let's move on to the future of the Phoenixville Hospital. So what's coming down the pike? Now, in the introduction, I alluded to the fact that there are changes in the facilities area, in the physician and nurse staffing, and in affiliation. So let's go into the first one of those, facilities.
Well, sure. Well, some things that we're in the snow season, so it's kind of covered up, but we completely redid our surface parking area, which really needed work thanks to the resources provided by Tower. We've put up new signage, and actually in the better weather, we'll be replacing all of the signage exterior to the hospital, which will have better visibility and easier to see, lit up better in the evenings and so forth. So those are some things that are just sort of, groundskeeping. But more specifically, right now we're investing in some significant technology. At the Limerick campus, we're replacing our PET-CT scanner, which is important for staging of cancer care for patients. That is a $2 million investment. And I have a list of technology and equipment that we're replacing, but more exciting, or maybe the most exciting, is we're finishing a plan. Actually, today is close to Valentine's Day, and on Valentine's Day, believe it or not, this plan has been in 6 months of work with a design firm to actually renovate our operating rooms and our OB area, and actually expand them as well. And we hope to be receiving funding for that from the Tower system for a kickoff next July, this coming July. Very, very exciting, great for the community, and something that will modernize those areas.
Yeah, wow, that's a lot of activity.
Yeah,
And it seems like to run a hospital, you have to be in a constant state of renovating, updating.
We have a list.
All of that kind of thing.
We have a list.
For the benefit of our consumers, maybe that's why healthcare costs is so high, because you have to keep up to date with things.
You do. Now, in the physician and nurse staffing area, there never is a day and week and month that we don't recruit physicians. And currently, we're recruiting, everybody should know Dr. Hans Haupt, who founded our CT surgery program. He's not going anywhere, so everybody relax. But we're recruiting him a second surgeon. That's how fast we're growing. So that's exciting.
Yeah.
More orthopedists, neurology, OB. So we're constantly adding new physicians there. In terms of nursing staffing, we have increased the number of nurses that we have in our nursing units, and will continue to do so. And we can't hire them fast enough. We have a number of vacancies, not because people are leaving, because we've created new positions, and we're very excited about that.
With regard to positions, just roughly, how many doctors are actually on staff?
Good question.
And how many nurses are on staff? Because
Right.
the reason I ask this is because I continually hear very good things about the nursing staff,
Right.
and that the doctors about how competent they are. So
Right.
I know we have a lot of them, but
Mm-hmm.
don't know how many.
Well, we have over 400 physicians on our medical staff, and that number keeps growing. So it won't be long before we're closer to 500. In terms of nurses, we probably have over 300 nurses, and recognize these are registered nurses, most of whom have their bachelor's degree and many of whom have their master's degree.
Yeah. Okay, great. Well, Steve, we're going to take a break for another commercial to pay the bills. Folks, we are interviewing Steve Tullman, the CEO of the Phoenixville Hospital, and we'll be right back after this word from our sponsors. So stay with us. Hello, everyone. Welcome back to For the Health of It. For those of you who might be just tuning in, we have the pleasure of interviewing Steve Tullman, the CEO of the Phoenixville Hospital, and we're kind of talking about all the wonderful changes going on at the hospital and what the involvement with the Tower Health System means for our community hospital here in Phoenixville. So, Steve, we left off at talking about things such as affiliation. So what are the new affiliations that you may be having?
Right. The most exciting one is the Drexel University College of Medicine. And for those who remember, or those who never or don't remember, that was formed as a result of the merger of two venerable medical colleges, the Women's Medical College of Pennsylvania and what was called MCP, the Medical College of Pennsylvania. Together they merged and became the Drexel University College of Medicine, which is the largest medical school of all our medical schools in Philadelphia. There are 1,000 medical students in the 4 years, very large. They approached us, and we approached them about an affiliation almost 2 years ago now, and we now are affiliated, and we will become a teaching system for their medical students and residents. And what does that mean? That means that Phoenixville, for example, possibly as early as this coming July, will become a teaching hospital for certain areas of medical training, those of which I do not know the specifics yet, but it could include things like emergency medicine, orthopedics, and a lot of other areas. Right. In addition to that, Tower, as an organization, is going to build a second medical school for Drexel, a second 4-year campus in Reading, which the freshman class will be the fall of 2020, and then another class added every year for 4 years. So a very exciting development, which all will do is uplift the quality of what we do here, and also provide a pipeline for future future physicians for the community. So very excited about that.
This may not fall under the topic, Steve, of affiliations, but it just occurred to me that the Tower Health System is really becoming more involved with mental health care.
Yeah.
And expanding their footprint in Reading for inpatient mental health care. Can you mention that?
We are building a much-needed 145-bed inpatient behavioral health facility in Reading in partnership with an organization called Acadia, which is a large national behavioral health provider. That should be open later this year or the early part of the fall of 2020. In addition to that, because of that expertise, we're hoping that we as a community in Phoenixville benefit from resources that could help our community, outpatient resources, access to necessary care, and we hope to be able to integrate that in the Community Health Needs Assessment Implementation Plan that we talked about earlier in the show.
Yeah, because in both of our needs assessments, mental health care came out as a huge need.
Right.
I understand you've won some awards.
Oh, yeah.
So tell us about that. It's always nice to be an award-winning hospital.
Right. Well, we're constantly seeking to raise the bar there. We're constantly getting accredited or reaccredited in areas of cardiology, orthopedics. radiology, mammography, cancer, breast care, and I could literally list those off, but the one I'm very proud of that this just happened in the early part of 2019, the Pennsylvania Safety Authority, which is a state agency to oversee and regulate safe patient care and report on it, be transparent on various measures across our state and our hospitals. Each year they ask for entries from all of the hospitals in the Commonwealth on different initiatives that hospitals have taken to improve safety or ensure patient safety. And there were over 400 entries and only about 3 dozen awardees. And our hospital received an award for an initiative that we've introduced called the Good Catch Program.
You got to explain that.
Well,
what's a Good Catch Program?
think of the Super Bowl 2 years ago and Nick Foles and the Good Catch.
Okay.
Okay, so that's our
Special.
logo. That's our logo. But the Good Catch is we want to reward our employees for identifying something before it happens and prevent it. So the Good Catch. And we've
Cool.
institutionalized that, and we have monthly recognition and awards and champions and so forth, even to the point of not just nurses, but we even had a patient transporter identify a patient who was exhibiting very unusual symptoms while he was about to transport that patient, got the nurse, and prevented the escalation of a stroke. So he was an award winner one year. We introduced that, we presented it to the state, and we won one of a handful of statewide awards.
Wow, that's awesome.
That's a very
Congratulations.
exciting
And it was
thing.
life-saving, too.
Absolutely, yeah.
Wow.
Yeah.
I understand your nurses are beginning a journey to achieve magnet status, I guess it is.
We talked about that, yeah.
What is?
Well, magnet status is the concept of magnet is you're sort of raising the bar for the care and care and feeding of your nursing staff, which in turn improves the care for your patients, and therefore you become a magnet. You draw nurses, and in fact, nursing schools are guiding their graduates to look for hospitals as future employers that have this accreditation or recognition because it indicates an enriched environment. And really what this does is by improving the quality of your nursing through additional training and support, you improve care, safer care, higher quality care, more satisfactory care. So that's where we're headed, and it'll take us about 2.5 years to get there.
Yeah, that's wonderful. We have time for just one really quick question, and I do want to make our viewers aware of the fact that the hospital is involved in lots of charity care.
Yes.
Just briefly tell us what you do in about 15, 20 seconds.
My most proud one is healthcare access. We're a proud supporter of healthcare access, and as I can't say enough the work that they do. The other one is our Healthy Baby, Happy Family program, which we started several years ago, in which we provide and fund for the prenatal care of women in our service area who are uninsured or underserved, so they don't go without that care, and then when ready can deliver the baby at Phoenixville Hospital.
Okay. Well, Steve, we're out of time. I wish we had more because we do have some more questions, but thanks for taking time out of your busy schedule to be with us.
My pleasure.
It's always great to interview you, and I know you're a Red Sox fan. I'm a Phillies fan, so we have that.
We have more to talk
baseball
about.
thing in common. Thanks for
All
being
right,
with us.
you're welcome.
All right. And thank you, everyone, for being with us. We appreciate your taking the time out to view today's show. We hope that you have found it informative and enjoyable and feel that you are now up to date on what's going on at your community hospital. I've been your host. I'm Lou Beccaria. And remember, folks, if you're healthy, you're wealthy. We'll see you next time.